Hello and welcome to the Vitality Project. My name is Dr. Hughes, and we have a special guest today, Alison Cohen, who is a master of physical therapy. Now we have to get some professional animosity out of the way, I think, because I'm a doctor of chiropractic and we have some physical therapists, and there's some tension between the professions, which has led to creativity. And so one term we use to describe your profession, Alison, we call you guys physical terrorists.
And we tend to call you guys crack addicts.
Crack addicts.
Yep.
Glorified massage therapists.
And a back cracker.
Okay. PT can actually stand not only for physical therapy, but personal trauma.
And chiropractors, you know, we kind of think of you guys as quacks who aren't real doctors.
Is it good?
Yeah.
We're out of the way? Okay,
Yeah.
good. We'll give it a
All
hug.
right, yeah.
Okay. So thank you for indulging in that bit of humor. A little bit of a story on Alison. We're neighbors, and that's how I met her. And I had injured myself doing martial arts and was losing the ability to use all of my chiropractic techniques. I couldn't adjust people correctly. I got her help. She helped me get my shoulders back together and strong and stable, and really hit a higher level of performance in addition. And we started talking philosophy and trading tips and secrets, and I said, this person has some knowledge. Let's get some of that out to people. So thank you for coming, Alison.
You're welcome, and thank you for having me on your segment.
All right. So let's get right into it. You're a physical therapist, and you manage a clinic, yes?
Yes, I do. I manage the Worcester clinic of Greendale Physical Therapy.
Greendale, because you have a green shirt on.
Yes.
Okay. So, you know, as I said, my experience was I had a shoulder injury, and then I came to seek you out. And what I've learned as a chiropractor, caring for people, is that when you get injured, you never heal to 100%. You're always either going to be weaker than when you started, or you're going to heal stronger with more integrity into the body, right? And this has been my experience. What have you seen?
Well, I think that when someone gets injured, if they're going to get weaker, it is because they haven't addressed the areas of deficits that might have led to that particular injury. But if they seek out care to not only heal from the injury, but then move beyond the what caused, like all the deficits they have that might have caused that injury, then they will emerge stronger because they'll have more stability, more strength, better posture, etc.
So you used the word deficit, and you said deficit could have caused the injury in the first place.
Yes.
What do you mean by deficit?
So people can get injured from many different ways. You could have a specific method of injury where you fall, or you trip over something and you sprain your ankle, or you break a bone. Or you could have what you might call repetitive use injuries. So you're doing an activity like playing a sport over a period of time, and you have some prior weaknesses that were there.
And you're talking about like a tennis swing,
Yeah,
repeatedly, every time into the arm, yeah?
Yep, and then if you don't have proper strength, stability, alignment, then you could potentially use the muscles incorrectly and then cause an injury.
So you talk about using a muscle incorrectly. Why is that bad, right? I mean, I'm trying not to keep it too simple, but if I'm going to swing in a sport, I'm going to use my arm to swing something like a tennis racket.
Yep.
How can I use my arm incorrectly?
Well, you can, for example, if you don't have good stability and strength in your shoulder muscle, okay, for example, you might not be able to generate the right amount of power or force to swing the tennis racket and hit the ball. If you lack stability and strength in your core and in your posture, then you could actually use the muscles in your shoulders ineffectively and then cause injury in the shoulder, or you could even injure your back.
Injure your back from swinging the tennis racket. And I find that all the time, and I guess the buzzword is the kinetic chain.
Yes. Yes.
So let's talk a little bit about kinetic chains. I mean, kinetic means movement, and the chain is talking about connection. You know, what do my abdominal muscles have to do with my hand swinging a tennis racket?
Okay, so your abdominal muscles are pretty big and strong, pretty large, and they help to give your spine and pelvis. They help support those bony structures and help to give you stability so that when you're swinging a tennis racket, you're able to control your body and maintain it in a good position when you're moving your arm through space. And because the muscles in your shoulder are a lot smaller, and while you can generate power and force with them, your core is really responsible for helping you sort of like follow through with swinging a tennis racket, so you don't like fall forward and lose your balance, for example.
And you talked about position, which is related to my favorite word, alignment.
Yes,
right?
alignment.
So you said that the muscles are large here and that they control the alignment. And my understanding is that the alignment of the shoulder, there are some positions that the shoulder really likes to be in that make it very strong. And if you move outside of those good positions, like if I try and lift a grocery bag from here, it'll cause injury. If I lift the grocery bag in front, it's much happier. Right?
Okay, so that's because when you are lifting or doing tasks where your joints or your extremities are much closer to your body, your muscles don't have to generate as much force to lift the bag of groceries, for example. But if you're trying to lift the bag of groceries from all the way behind you, your body has to create a lot more force
to make up for the lack of alignment.
Yes. So if you then try to lift the bag from too far away, you're going to use all those smaller muscles, and if you don't have the power and strength and alignment in your core to prevent you from like really, instead of using your core to help lift the bag up, which would be the better thing to do if you're trying to get it from further away.
Like behind the seat in the car, no? Yeah?
Yes. I mean, obviously you should lift an object that, closer to your body versus far away. But if you then try to use, your arm muscles that are a lot smaller to lift up the bag, and they don't have that strength or stability, and you're not using your core, you could injure your shoulder that way.
So I guess there's two parts to that. One is, how do you build up the body through the core and through some stability, maybe condition some of the small muscles. And then the second part is, if you've been injured, is it too late to build the muscles? Do you have to heal first?
No, it's never too late to build strength or to build stability.
Totally agree.
What I believe first you need to do is create good alignment within the body. So you need to look at, as a physical therapist, I'm going to assess someone's, posture and see if they have any deviations in how they're holding their body in space. And I'm going to look at their alignment in their pelvis. I'm going to look at their core stability and strength. And you can use a variety of techniques to help create better alignment within the body. Now, going forth from there, once you have good alignment, you can then strengthen the muscles properly. If you try to strengthen a muscle when the body doesn't have good alignment, it's not going to be as effective in the long run.
Wow, that's awesome, and there's a ton to go into there, so let me see if I can keep it all in my head. One of the things I noticed is when you went through that list of checks that you do on a person, we didn't talk about whether it was an ankle injury, a knee injury, whether it was the right side, the left side, whether it was a shoulder. It sounded like you had a protocol for evaluating a human, and then you would go to the injury. Does that sound accurate?
Yes. So while it's important to look at the specific body part the person is coming in complaining about, whether that be, for example, the shoulder, since we've been focusing on that, I really feel it's important to first look at their posture and their alignment, because I can then treat those areas as well to give them a strong foundation and then also be able to treat the shoulder.
Nice. And you said it's never too late, so even when you're addressing a specific injury, you're always looking to the core. So how do you recommend that people strengthen their core, let's say proactively? Let's say that we're without an injury for a moment. What are some of your favorite ways to strengthen the core?
To strengthen the core, I think some of my favorite types of exercises would involve yoga, I think, is a great way to strengthen the core. Pilates is a great way to strengthen the core. Using stability balls are a great way to strengthen your core.
The big Swiss balls, you mean? Yeah, that make you feel like an idiot when you're on top and you start wiggling. Yeah.
I think also working on balance is a way to strengthen your core. And also strengthening your hips is going to help to strengthen your core too.
And then when you say work on your balance, how do you do that?
You can do all different types of balance exercises. So whether that's working on standing on one foot but keeping your core muscles engaged, or standing on an uneven surface like a pillow to work on your balance. Closing your eyes will, and standing on one foot will help you work your balance.
Yeah. So something else that interests me, but one difference between physical therapists and chiropractors, and we were talking a bit, and we realized we all want people to be strong, resilient, and happy, right? We're looking for these characteristics. But one difference is I tend to work inside out, meaning I'll adjust a person to restore alignment and breath and create the postural change, and then send the person out and say, go exercise, do what you love, and you listen to your body. And that's the end of what I need to do. When they come back, I evaluate the spine skeleton for subluxation, and I look at how it's affected them and say, it looks like your body's under tension here, it's bothered you there. Take that information and go figure it out. When you worked with me, you were very specific. Do these 8 things in this order at these times, this many times a week. To me, that's an outside-in input, right? Dig into that a little. I mean, you're very specific about it.
Okay, so when it comes to, can I use this as an example? On rehabilitating your shoulder, while I did look at you as a whole person, looked at your alignment, core stability, in terms of your shoulder, I needed to give you specific exercises to work on stretching the muscles that I felt were tight, and to work.
One on the door you had me do, opening up the rotator, and
that'll open up your chest muscles, and also giving you specific strengthening exercises for specific muscles that I felt were particularly weak.
And there are, just to catch everyone else up, there are 4 rotator cuff muscles, and I don't have to go through them all, but she differentiates, instead of small muscles, which we've alluded to, specifically which ones to strengthen. I mean, like very down to the specific small muscle.
Yes. So by strengthening those specific muscles in a specific way, okay, they will get stronger, okay, and then you can build upon the strength of those small muscles, and then address strengthening the other muscles around it and creating, greater stability within the shoulder. So you can kind of like move forward and do more advanced types of exercises to strengthen the shoulder and postural complex.
And so what I just heard was you start very small and very specific, and then come out, and then start looking at broader and broader pictures to create that stability.
Right, because if you start giving someone exercises they might not be ready for, you could actually contribute to the injury in that it could take longer for them to heal, or they're not ready to do that kind of exercise yet. Their body just is not ready for it.
Yeah, and I've often found people have trouble managing their intensity when they're healing. How do you work with someone who gets an injury, they haven't really accepted how important or how impactful that injury is to their entire body, and they do a couple of moves, and then they want to move on and think they're better? How do you gently let them know this is going to take a while? Yes, you can get strong, but patience.
I have a really quick example. I work with a patient, and she was a runner, and she wanted to run a 10K, and I said, okay, you're going to have to stop running like you're running right now in order to be able to run that 10K, and we're going to do the specific exercises and work with you. And she wasn't quite ready to hear that, and so she would go out and do some running, and she'd come back and it's like, well, I'm feeling a little sore on my hamstring here, and I said, okay, this is why. And so she saw, okay, maybe I should back off on the running. She listened. We went through her rehab protocol, and she was able to run her 10K in a month pain-free,
Nice.
and she did great.
Yeah, and I've found that sometimes it doesn't take long. You just got to take your foot off the gas, let the body recoup, and then go. Right?
Yep. And we gave her the tools that she needed to be able to not just have us help her heal, but like heal herself, and then have those exercises as tools to prevent the injury from happening in the future.
Nice. So the word chiropractic, right? It's a Greek word that means done by hand, right? And that's another major difference between what you do and I do. I understand you guys have a lot of toys in your office,
Yes,
right?
we do.
A lot of input. Go into some of that. What do you do to help someone heal from an injury and strengthen them?
So we use therapy bands, we use exercise balls, we use something called a BOSU, which is sort of like a balance disc. We use free weights. We use a Pilates reformer machine. We have aquatics therapy.
The reformer's the big one,
Yes.
right? All the pulleys on it, yeah? Okay.
Yeah, we have a TRX setup.
Nice.
We also can use various modalities, ultrasound, heat, and then we also use a lot of manual therapy.
Awesome. And I, again, we have an overlapping, we want strong people that are happy and enjoying their life, but that's another major difference is, my profession being about the hands and really about inside out restoring alignment. And that's entirely where we are. That's what we're doing to bring about this change from the inside. You guys seem to have this much broader ability to get in and work that way. So it's like you have a series of different stuff to get to that kind of strength. And I love the differences between the two of, how does that fit in? So what got you to become a physical therapist? What got you excited about it?
Well, I was 8 years old and I had a problem with my hip. And I had to have some surgery and had to have physical therapy to learn how to walk after the surgery. And I thought it was, kind of cool being in the therapy room with all these different exercise toys and things of that sort. And I also have always been very interested in medicine, and I wanted to do something with my life where I could help people and make a difference. And I decided, as a freshman in high school, that in doing physical therapy, I'd be able to, help people recover from an injury or teach someone to learn how to walk, and that would give me a great deal of satisfaction. And I love what I do. Like I really have made a huge impact in a lot of people's lives, and it's a really good feeling. And
nice.
Especially, getting that positive feedback from clients.
Yeah. Well, and you help more people get adjusted. Because I might have had to decrease my hours or even take some time off from practice if I didn't have knowledge, if I didn't have your skills. So I appreciate you and what you do.
Well, thank you.
So another interesting difference I've found between the two professions is, like I adjust a lot of kids. And what happens with children is they don't stay symptomatic for very long. Kids tend to recover pretty fast. And I even take care of a lot of asymptomatic people. They have no disease, they're asymptomatic, sometimes newborns, and everything's peachy with them, and the parents want to get them adjusted for the alignment to keep the strength moving. My understanding of physical therapy is you guys tend to specialize on the other end of things, bringing someone back from injury.
Yes. Yes, so typically, someone will come to see a physical therapist because they have some type of injury or they have some type of weakness or disease process that they need some rehabilitation to get them stronger so that they can do go about their normal daily lives and do their normal daily functions without any limitations or with less limitations than what they had.
Yeah.
We in physical therapists we are trying to move more towards a preventative or wellness type of care with people. So sort of educating people on injury prevention with proper types of stretching and strengthening exercises. But typically a patient just doesn't walk in completely asymptomatic and say, "Can I have some physical therapy?" It's usually not how it works.
Yeah, and there's a mindset around it, and I would love it if everybody saw a PT at least once a year.
Yeah, I think that would be
just to get
great.
evaluated, and then they could modify their exercises and just take the data year by year and say, oh, how's my body changing?
Which I think that there are some clinics that do that or are working towards that. I know that's something that my clinic is probably thinking about doing, is having people come in and we would assess their posture, their general strength testing, and they can come back a year later and get reassessed for that.
Right.
So.
Right, and maybe no modification is necessary. You're just keeping track, and the person can test himself. So another question, I mean, you're a manager of a clinic.
Yes.
Obviously you know a thing or two to be able to be in charge of other physical therapists.
Yes.
How do you use chiropractic for yourself? I mean, you got interested in it?
Yes. So I got interested. I really didn't know anything about chiropractic medicine until I met Evan, and I was having what I thought was carpal tunnel in my hands, and I couldn't type very well, and I couldn't treat my patients as effectively either, being numb in my hands. And so I started seeing Evan, and what I really learned about chiropractic medicine and how it helped me is that pretty much my carpal tunnel went away. And I think that by seeing Evan, he's helped me, consistently, on a consistent basis, has helped me maintain my own alignment from a physical standpoint. So having good alignment in my spine, good alignment in my pelvis. I've always had a leg length discrepancy, and I think Evan's pretty much gotten rid of that for me.
Well, your body did the work.
Yes.
I just did the adjusting. But yes, I get what you mean. Yeah. And I had forgotten that you even had carpal tunnel. It's a gone issue to me, right? And
yeah.
it's not in my mind when I adjust you.
And also, I feel that by seeing Evan, I've come to have a much greater awareness of my own body and my own alignment, and I know I can tell when I'm out of alignment and I need to do something to correct that, whether it be something I can do on my own or I can come to see you for. I also feel that by maintaining good alignment from a physical standpoint, I also maintain a good alignment from a mental standpoint, and I can be a much more effective physical therapist for my patients, because then I can look at them and have a much quicker, keener, faster understanding and innate knowledge of what is going on for them and how I can treat them and help them get better, and it's really great.
That's nice, yeah.
And I really feel that I've learned that I feel everyone would benefit from seeing a chiropractor at some point in their life, and I always recommend to patients who ask about chiropractic medicine, should I see a chiropractor? I say, yes, you should see a chiropractor, because they will be able to help you to attain your alignment, maintain your alignment, and they can do different techniques that I can't do as a physical therapist. And I think they're highly beneficial, and I really feel that the two fields complement each other.
Yeah.
In some ways, we have our differences, but then I think we complement each other, and the patient could become that much more able to do the things they want to do.
Yeah, I really like the idea. I mean, there are some things that are divergent, whereas I would say, let the body sort that out. Your profession would say, no, let's change that. Let's manipulate it. And vice versa. You might say, no, this is fine. That person doesn't need to be adjusted. I'd say, no, yes, they do. Look at these indicators. But what interests me is that obviously you had access to good PT when you found me, and you got adjusted. And I had access to excellent chiropractic care when I hurt myself and needed your help. So I love the idea of having options, more input into the body, and having a vision of what you want it to do. I feel that so many people have lost, I don't know if you've found this, seeing people, they've lost a lot of trust in their body. There's a culture around, how's your body? And they start listing all the things that are wrong, instead of saying, wow, I woke up this morning and was able to take a deep breath. Miracle one. And then, how many great things happen to us. We don't have a culture that celebrates how strong we really are.
Yeah, I think that people, they do tend to focus more on the things that are wrong with them, their weaknesses, their limitations, what they can't do. And I feel that if that's been going on with patients for a long time, it also gets them down emotionally, and
Yes.
and then they
get
have a hard,
depressed, they get anxious.
and then they can't. Then it's almost like, well, I'm never going to get any better.
Yes.
And then they come to see a physical therapist. For example, a patient today told me that she, for the first time, was able to stand and cut vegetables.
Nice.
And she'd never been able to
Nice.
stand. Her husband came home and it's like, "You're standing, cutting vegetables?" And she's like, "Yes." And it's all because of what physical therapy has been doing for me. So a patient called me yesterday and said he was able to drive for the first time, and he doesn't know how long without having any numbness in his hands because of some work I did on him, and
Nice.
he felt fantastic.
Nice.
So it's about so you're sort of taking the and these patients were very down about the fact that they just weren't able to do what they wanted to do. And as healthcare professionals, we can, basically turn that around and work with them and get them. And it's like, oh, I can do this. I can stand and cut vegetables. I can drive without numbness. This is great, and let's move forward.
Yeah. That's huge. And another thing that's a bailiwick of mine that I'm always saying is it's a patient's choice, right? Sometimes they want to go to a single person, and this drives me crazy about MDs, and I think MDs are wonderful at what they do, but sometimes the statement will be uttered, "There's nothing that can be done." And that drives me crazy because they don't know everything about everything. So to have access to people in different places and to make the choice, to say, hey, I'm going to walk right into a PT. And people can do that, can't they? Can't they just seek you out without another professional?
Well, Massachusetts is a direct access state for physical therapy. So you don't necessarily need a prescription from a doctor to see a physical therapist.
Yeah.
It really depends on the insurance company. So some insurance companies require a doctor's prescription.
Red tape and rules and things
But
associated.
we, at my clinic, we do self-pay. So if you can pay out of pocket and see us, and you don't need to see a doctor. You can just come in, we evaluate you, and
you take care of business.
And take care of business. And another unique thing about the practice I work in is we have a quick tune-up program. So a patient finishes their course of therapy, and they, a month later, they're feeling a little creaky or sore, they can come in and we can do, a little quick tune-up with them. So look at their alignment, their posture, do some manual therapy, get them, good to go, and it's a way to sort of maintain the work that we've done with the patient, and they don't need to go back to the doctor, they can just come see us.
And get it done. That's great. So to finish up, to wrap up, this is something that interests me greatly, is I don't like all chiropractors. I like the skillful ones, right? And I like the ones that have a clear vision of what they're doing. So when I'm sending someone to a chiropractor, I'd say the first thing you want to look for is a chiropractor that embraces adjusting children. And any chiropractor that isn't adjusting children, in my opinion, this will get me in trouble now, they missed the point, right? We want to adjust everyone to create this strength, resilience, and really consciousness in people, like you were talking about, that mind-body link in infants all the way throughout life. To me, that was the basics, right? The second, I prefer chiropractors that use their hands and not a lot of equipment. And there's a brilliant friend of mine that does use an activator, and I tease him endlessly, but he's great. But someone who works with their hands and adjusts kids, good chiropractor. What are some things people need to look for in a skillful PT? Because I'm sure not all of them are as wonderful as you are.
Well, thank you. I think that if someone's looking for the qualities you need to look for in a good physical therapist are someone who will look at you as a whole person, not just a body part. Someone who will do not just prescribe exercises, but also use various types of manual therapy to assist you in your rehab process, whether that be joint mobilization or taping or cranial psychotherapy, whatever.
They have options
They have
on how
options.
to care for you.
Yeah. I feel another great thing to look for in physical therapist is someone who will listen to the patient and what they have to say. someone who believes in their patient, believes in their profession, and then also who offer different types of adjuncts to therapy. So like, pool therapy, for example, exercises in a pool, or which my clinic offers, and we have a rehab Pilates program, or using yoga, or other types of treatment methods. And also there are therapists who even looks at diet and nutrition, for example. Because I really feel that is really important in helping you maintain, good health.
Have you noticed that people who eat very deliberately and spend a lot of time in the diet heal faster than those who don't?
Yes.
Yeah,
I
found
do.
the same thing.
Yeah.
And at any age.
Yes.
Awesome.
I think it's, the more nutrients you put into your body, the faster you're going to be able to heal.
That's fantastic. So that's a ton of information. At some point, we may have you come back because you have a lot of knowledge, and we appreciate it. But that's good. So this is Dr. Evan Hughes. Thank you for attending with the Vitality Project. I want to thank Alison Cohen, our master of physical therapy here, and stay vital.